Welcome to the Continuing Education module, Major Program Models for Worksite Wellness, selecting the right wellness strategy. The agenda for this particular module includes possible program goals for wellness programs, understanding each of the major program models or strategies, and that includes the feel-good wellness model, the traditional wellness model, the results-driven wellness model, important implications of each of the models, and a summary of key points. Our definitions that we're going to use for wellness includes the idea that wellness is an intentional choice of a lifestyle characterized by personal responsibility, moderation, and maximum personal enhancement of physical, mental, and financial health. So this is the context that we're using when we think about wellness. When we think about worksite wellness program, we're dealing with an organized program in the worksite that is intended to assist employees and their family members in making voluntary behavior changes that reduce their health and injury risk, improve their health consumer skills, and enhance their individual wellness, productivity, and well-being. This allows us a fairly broad range of approach to worksite wellness, and it also links us back into such issues as health plan performance, sick leave absenteeism experience, workers' comp experience, disability insurance experience, and presenteeism related experience. Our typical goals of a wellness program include the following. First of all, to improve employee health. So in some measurable capacity, we're attempting to see some improvement. Secondly, generally employers are looking at reducing the growth and the trends, the medical trend, for their health plan costs. And that's one of the central issues that we tend to look at. It may include issues of looking at how sick leave experience is being reduced, or workers' comp cost, or disability insurance costs, or presenteeism related costs as well. Also, to reduce the occurrence of health risk, which has an impact on the future economic pattern of healthcare needed by the population, as well as how we measure and look at those health risks. Save money for the employer in some of the 5 possible economic variables and or the way in which those variables are translated into productivity at a given employer. 5 is to enhance a goal of enhancing employee productivity. So we're looking at some dimensions that will essentially help people be more effective in their work processes. 6 is satisfy employee needs. So oftentimes our goals are to meet the needs employees have for their own wellness and or well-being. 7 is to improve recruitment and retention. So that gets us into what's called the value on investment nature of wellness programs. And 8 is to change our organizational culture to perhaps make it more wellness oriented. So these are very typical goals for wellness programs. The presence of these goals will have a direct relationship on our choice of the model or strategy we use and how we go about doing it. There are different ways of doing wellness. So when we look at the 3 basic models, the feel-good wellness, the traditional wellness, the results-driven wellness, and its main features, its primary focus is for the feel-good model on morale and improvement of employee morale. The traditional wellness program is more of an activity-oriented approach, and the results-driven wellness approach is in fact more of a results-oriented approach, which allows us to achieve results in a hierarchy of results from lower level results to higher order results that may include economic variables and or issues of health improvement and health status improvement. The feel-good wellness program model tends to have primary wellness targets that we focus on as fun events. Sometimes stress relief is one of our major issues that we're dealing with in a feel-good type approach to wellness. Some of it may include nutrition, and particularly in food choices at work. It may include some community service aspects. It also may include general wellness information or well-being information, as well as general health and health risk information. Participation for this type of program is relatively low. It's in the bottom run of the ranges for the three models. Its approximate cost is at the low end. So we're looking at less than $50 per employee per year. All the costing we're going to see with all three models does not include staffing or incentive costs, but does include a vendor budget for wellness services. Likely return on investment is likely to be under 1-to-1. So it doesn't necessarily produce the economic return that many employers want to achieve with goals that have to do with enhancing productivity or reducing health-related costs for their employees. Typical activities for this type of program include things like holding a health fair, a lunch and learn sessions, a wellness event, a community sponsorship of a 5K walk run, chair massage options brought into the worksite, free fruit provided as an encouragement for eating more fruits, and wellness materials in health and human resources, health cartoons that are circulated that bring up the wellness issue, nutritious potlucks that have recipes that for things that are good tasting but also healthy for you, movie events in terms of inspirational movies or movies that are enjoyable with a health message. Company games may include our ability to have the social support of being more active around things like company or corporate games. So these are fairly typical feel-good wellness program model activities that we might look at. We also might offer a celebrity event where we have a sports figure or a local newscaster come in and talk about personal excellence or making significant behavior changes or being inspired to improve oneself. So lots of different topics that we can use and then link that to the celebrity event, which then links oftentimes to another type of wellness activity. So again, these are typical activities for this particular model of wellness program. The feel-good wellness model, we choose it when our return on investment or health benefit cost effects are a relatively low priority. We might also choose this feel-good model if we're new to wellness, not quite sure about what we want to do, and want to introduce employees slowly to wellness as a topic area that's addressed by their employer. Strained employee-employer relations, so the issues around how we have anything that may be disrupting the good feelings between employee and employer. When we have a tight timeline or a limitation on how quickly the program is supposed to roll out, this is an easier model for us to implement in terms of wellness programming. And if we have a lot of young and/or healthy employees, or perhaps not so concerned about health risk for the population and their impact on future health costs, but we may in fact choose to do something more in a morale mode. So in summary, these are the kinds of characteristics which would lead to the choice of this particular model of wellness programming. Now, when we look at the traditional wellness program model, our primary wellness targets might include everything that we choose to keep from the feel-good wellness model. So that may include some of the targets we saw on the previous slide, and it may also then include an expansion of targets to include something like an overall wellness score, which I may get from a health risk assessment or a well-being assessment that I give to individual employees. There's also the issue of cholesterol and cholesterol levels and fractions, and being able to conduct that as part of a preventive screening activity, along with blood pressure measurement. It can include issues of tobacco use, so issues around smoke-free work environment and/or providing options for people that want to change a habit they have related to tobacco use. It may also include the issue of beginning to look at obesity. Obesity affects about 2/3 of our employee population as either overweight or obese. So it's an issue that we oftentimes want to address fairly early in a traditional wellness program. And then medical self-care is the issue around how do we help people get better skills at being able to triage the symptoms that they customarily have individually, about 24 times a year on average, according to the National Health Survey, having a personal health symptom, and or our ability to help our family members treat and or home care and or seek medical attention when appropriate. And then finally, physical activity, which generally is our gateway behavior that we oftentimes want to introduce in wellness programs to help people increase their level of activity. Participation in this traditional wellness program model tends to be higher. So we're looking at that 20% or so that are already intrinsically motivated for wellness, affecting that 20%, and then also beginning to affect more of the people who are not intrinsically motivated. We're usually doing that through offering programs on work time in the workplace, making it easy for them to attend, as well as to work with incentives that provide reasons for them to engage or to be active in doing a particular activity. The approximate cost minus staffing and incentive costs, because there's many ways that I can do those at no cost, the budget is going to pick up where our feel-good model left off and then move up to around $200 per employee per year. We need also to remember that we're spending on average about $30,000 a year on health-related benefits, including medical plan costs, sick leave absenteeism, workers' compensation costs, disability costs, and presenteeism, which is lost productivity when someone stays at work and has an underlying health condition or set of health symptoms. And the likely return on investment is going to be higher than the feel-good model. It's going to be around 1.5 to 3 in terms of cost-benefit ratios, which makes it 150 to 300% return on investment each year for the program activity. So that's the context for this traditional wellness program model. We then also bring anything from the feel-good model that seems to apply forward into this model. We then include a health risk assessment or a well-being assessment, biometric testing options around the cholesterol, blood pressure, percent body fat, BMI, fitness club memberships or facilities, either subsidization, providing corporate discount, or providing an on-site facility, weight management program, smoking cessation program, web-based health information, oftentimes through an e-health portal, healthy cafeteria vending options, a self-care book or access to a self-care software app, preventive medical benefit coverage, providing a wellness newsletter, short-term incentive programs around challenges. So these are some of the major typical activities that come with this traditional wellness program model. The traditional wellness program model, we choose it when, first of all, ROI is a moderate priority. Management seeks to do something about future medical trend on the health plan. Where there's a 2+ years of wellness programming, primarily in the feel-good model, and we're looking at moving to the next level. This particular model is an activity-driven model, so we're looking at putting more activities in place that employees can utilize. Also, where employee entitlement mentality is strong. So if there's a very strong entitlement mentality, an expectation that employees expect various things from their employer, if that is high, this tends to be a model that helps meet that because we are structuring a number of different activities. Also, where we have a moderate or modest budget support, this is oftentimes the mid-range approach. So this gives us some moderate budget support for this activity. And then tight competition for talent. Wherever we are doing some things that want to attract people for recruitment purposes and retention purposes, we may in fact use this particular model in that situation. And where you're not good and the organization is not good on follow-through, this model is easier for us to implement. It essentially is event-driven, and it's essentially multiple tactical kinds of wellness activities. So those, again, are the characteristics that would opt and make this particular choice of model a good choice for a given employer. Now, the results-driven wellness program model is that third model that we looked at. And the primary wellness targets, everything from the traditional wellness model, and that may mean bringing some of the feel-good activities forward. Plus, we start to then focus on a broader range of productivity-related issues. Injuries become more of a concern for us, both in the work site, but injury prevention in the home setting, vehicular situations where we're traveling, and recreational situations. So I may expand my injury prevention activities in that type of approach. And then I also begin to start looking at health cost and healthcare utilization issues. So I'm dealing with the issues around consumer health education and how people are using and utilizing their benefits. And then also presenteeism. So if I'm focused on presenteeism, I am looking at how to reduce some of the productivity loss when someone does stay at work that has an underlying health problem or issue. And then I'm also adding some concern for resiliency. So I may want to be talking about the hardiness of my employees and their ability to be resilient to the kinds of demands that their lifestyle is requiring. So that also comes along with more integrated programming where I'm looking at various ways to integrate wellness more effectively. And in addition, I'm also looking at more health consumerism issues. So I'm looking at how and where I need to help people feel more comfortable making decisions about their own health and well-being, and particularly their use of healthcare services. In terms of participation, I'm at my highest range. So with these types of programs and the main features that go along with results-driven wellness programs, we're generally looking at using stronger incentives linked to benefits and creating a much more powerful, compelling reason for them to engage in wellness. So the participation levels go from 65 to 95%. So these are programs that are reaching more deeply into the population and into the spouses and spousal population associated with the workforce. And our approximate cost per employee per year, minus again the staffing costs and incentive costs, tend to be in the upper range where we're looking at $200 to $500 per employee per year. So that becomes our wellness budget. And our likely return on investment is going to be the highest of the three models. So we're looking at 2.5 to 6.5 cost benefit ratio, which equates to 250 to 650% return on an annual basis. So those are the characteristics associated with this particular model. And then we include everything from the traditional wellness program model, plus we start to incent and use for targeting and use for planning and evaluation purposes, more of the health risk assessment or the well-being assessment. We start using risk stratification and incented interventions to bring about more use of the interventions that are available through vendors and through our health plans. We start potentially using telephonic coaching to help people make some of the changes in behavior. We begin to offer medical self-care and consumer health education skills. So we do some things to augment that either through a learning management system online module and or workshops of various kinds. We oftentimes also start looking more deeply at injury prevention, and that again includes worksite, home injury prevention, vehicular injury prevention, and recreational injury prevention. We also begin to look more at benefit-linked incentives, perhaps using premium contribution differentials so that people are rewarded for doing wellness and can actually have a lower purchase price on their health benefit coverage. And we also start using wellness achievement incentives. So we're doing more to essentially offer various types of criteria that people can meet around wellness and getting on the wellness bus. We also begin to do more things that are oriented toward resilience and increasing our productivity while we're at work. And we also are serving more spouses. So we're reaching out to the spousal population with many of the same interventions that we've designed for our employees. And we have done more in the way of integrated programming. So we've started to look at how well does the various wellness programs relate to each other and the interventions and how well they reinforce, use information from, remind people about, and also how the wellness program connects with other organizational activities that have a functional relationship to improved health, like EAP or like benefits or like our return to work programs or disability insurance, disability management. So we begin to do more integration of wellness into those various areas. And then level 3 integration is when we are better integrating our wellness program with local resources, those things that are outside the work site, that are external to the work site. So those are the integrated programming related issues for the results-driven wellness program model. And we also begin to use more of the results-driven wellness framework, which has more of its features as well. So it broadens out our approach. We may have a well-being initiative. We may have other things that we can do to enhance the health and well-being of our population. Those may include things such as consumer training, medical self-care, ergonomics, advanced directives, injury prevention, all of the variety of things we've mentioned, plus others. So those activities then become the typical activities associated with this results-driven wellness program model. We choose this model and the fit is high if our ROI concern is a high priority. Also, if we're oriented toward the 5 economic variables: health plan costs, sick leave, workers' comp, disability, and presenteeism, and our concern for impact in those areas is high, that makes this model a fit, an appropriate fit. If our wellness program activities are mature and we need to change up the model and to do some additional things that create novelty effects, that's another thing that makes this model a good fit. If our employees feel like partners, they trust management, and there's been a kind of a long-standing partnership model that fits well with this particular program model for wellness. And if there are significant health risk or an older population, and we know that if we want to affect many of the economic variables at the same time improving the health of our population, if their average age is older and they have a significant amount of prevalence of risk factors and the severity of those risk factors, that makes this model a good choice. And finally, if they're capable at cross-disciplinary teams, if they're used to working in a cross-disciplinary way, that would be another issue that would be appropriate for this particular program model. Now, the effects of our various program models are also part of the choice and the issue of which ones we choose for our organization. And what this shows is the 3 models: the feel-good model, the traditional model, the results-driven model. And then it looks at the amount of change that we can and the results we can drive with this particular area. And there are informational related changes, and you can see the models progressively create more effect. The motivational aspects, the actual behavior change effects, the economic change and its effects, and cultural change and its effects and results. So what you see here is the way in which we look to a higher level of achievement and a higher amounts of results and change with a movement from the option 1 to option 2 to option 3. Now, a summary of key points for this particular module. First of all, there are several different major ways of doing wellness in the work site. There isn't just one way. And there actually are some different ways of approaching it that have commonality, that help us and help communicate and align the major interests and expectations of management with our approach to how we're actually doing the wellness program. Those different ways are usually referred to as different strategies or program models. And there are three major strategies or program models that we choose from: the feel-good model, the traditional wellness program model, and the results-driven model. The type of wellness program model you adopt needs to be appropriate for your senior management's expectations for the program. And that's one of the major reasons why we talk about three different ways of doing wellness. The program model you use should be strongly influenced by the goals of your wellness program. So if your wellness program has pretty ambitious goals, you want to be at the results-driven wellness model. The various wellness strategies or program models can include hybrid forms. So these are not mutually exclusive. They actually can include activities that flow from one to the other. So we do have that provision and that general approach. Each program model involves a different approach to wellness and will produce very different results. And that's where we want to get the alignment between the expectations management has and the way in which we are going about our wellness program. And your program is likely to evolve through the various strategies or program models over time. So we do in fact have a variety of different types of models that we use at different times as these programs mature and evolve. And lastly, one of the most important issues is alignment of the model with management's expectations about the wellness program. You do not want to be doing a feel-good model and have management expect to produce the level of results associated with the results-driven model. Now, let's answer some key questions in this particular module. Our first question is, do senior managers know about the different ways of approaching wellness? My experience with 1,000+ employers is that generally they do not appreciate the different ways of doing wellness. They think wellness is all done in a certain kind of continuum and you just change the various activities, but then expect and have expectations which may be very unrealistic. They need to understand the three models. So those three models I've found to be critical to senior management's understanding of what they're attempting to accomplish with their wellness efforts. Usually we must align the expectations with the desired results from our wellness effort. And we need to do that in order for it to be critical to the future of wellness. If we suddenly think that wellness does not really achieve much and we think it's all the same, we've really lost an opportunity to use wellness programming in a way that can really accomplish a great many results for our employer community. And we also have the underfunding issue, where employers want perhaps a high level of results but don't want to put enough money against a program activity. So it leaves us limping along with a tactical wellness program that has expectations on management's part to produce very strategic and large or significant results. So those are all some of the issues which come into play as our senior managers, if they're not familiar with the different strategies for doing wellness. Question number 2 is, how important is the choice of wellness strategy or program model? And I believe it's of vital importance in our planning process and in our thinking and strategies around wellness. And I think that we also have to have employees and management understanding these differences, so that if we are confused in either of those areas, either management confusion or employee confusion, I believe that adversely affects our ability to use these programs to actually achieve some meaningful results. And I believe the model and the funding adequacy must be matched, so that we cannot really do wellness in a tactical way and expect strategic levels of results. The third question is, when is it best to discuss these alternative models of wellness? The feel-good model, the traditional model, the results-driven model. And my suggestion to you is early and often. We need to be discussing this early and often. And at particularly budget time, at planning for the next year's program, and evaluation time when we're attempting to find out what have we achieved through our wellness program. Those are all ideal times, good times for us to be talking about these alternative models. And I would suggest that you get comfortable enough to talk about these yourself by being able to write them on a board, a whiteboard or a flip chart or a computer screen, and actually say, now here's this model, here's its characteristics are this, there's a second model, its characteristics are this, the third model has these characteristics. And then talking about matching the choice of these strategies or models with the organization's needs and interests. Now that you've completed this module, go ahead and take the quiz.